The technology for hearing aids has just come so far. Even compared to last year, it's amazing what's happened in the last 12 months with hearing aids. And it's fun. It's fun to be part of that technology curve and seeing things go from a 2-channel hearing aid to a 16-channel hearing aid in over time. If you were to come here for a hearing aid, we would fit you with the hearing aid. We do, of course, do the hearing test first, but then we'd run a number of tests on the hearing aid to make sure it's fit appropriate. One of those tests is verification. We put a probe mic in the ear. We measure how much volume the hearing aid's producing based on the size of the ear canal, and it's just an extremely accurate way to fit a hearing aid. It'd be very difficult for a patient to say, or even for me to say, I need a little more volume at 4,000 hertz in my left ear. It can't be done. And so that's what that machine does, is it allows us such specific information. And you find that after the first fitting, some people we work and work, but for the majority of the people you work with, the setting's set. I mean, they're good. And they also have the confidence because they see the machine, they see what we do, they see the test we do, that they feel pretty confident that they've had a good test, that what we're doing is the most that can be done to help people hear better. Then after the fitting, we're going to sit down and we're going to discuss their needs. We're going to discuss how to take care of the hearing aid, how to change the battery, just the very simplest things, and it makes a huge difference for people. When they leave, I give them a sheet that talks about everything we just did. So they're listening and they're enjoying it because they're not so scared that they're going to forget something that's important. And so, it's overall, it's a real positive experience. And, someone walks through the door, I'm excited. Today's the day we're going to start hearing again. It's fun. There's this decision out there, I have a hearing loss, now what? Who am I going to talk to? What am I going to do? First of all, recommend an audiologist. It's someone that's been medically trained. The partnership with the ENTs here is a nice mix with that, because not only do you get the audiologist, but you have the backing of 7 docs. I've had a number of patients tell me experiences where they went somewhere for a hearing aid, they were fit with the hearing aid, and they never went back. And if they did go back, they felt sometimes uncomfortable with asking for help with it. What I hope happens here is that they just feel very warm and welcomed, and that when they're working with the audiologist, they feel like that person is confident, that they care about what they're doing, they care about their life, they care about how they're hearing, and they do everything they can to address those situations. We sell a number of different products. We don't just sell one manufacturer. So if someone comes to me and they have a profound hearing loss, I know which manufacturer I'm going to use. If they come to me and they have one ear that's dead, that's another manufacturer. So I'm pulling the best from every manufacturer out there, and I'm trying to fit that on the person based on the patient's needs. Now, if I was to only use one manufacturer, that would probably be easiest for me, but it probably wouldn't be what's best for the patient. I'm very proud to be part of a team that are doing unbelievable testing, fitting great products, and pulling from a variety of manufacturers to make sure that we're getting the right product on the person, and to work with the doctors here on a daily basis with patients to know that if there's something medically concerning us, that we can, walk across the hallway and ask advice.